Hi everybody. Today we will be discussing about the anatomy of bronchopulmonary segments. In this group, we will have the following presenters: Carlos Mario Hincape Castaño, Kevin André Rivero Ramírez, Miguel Ángel Bedoya Cardenas, Natalia Posada Echeverri, Daniela Ortiz Gallego, and myself, Natasha Andrea Ospina, who will be the person presenting for Daniela Ortiz Gallego and the information she completed for this assignment. Bronchopulmonary segmental anatomy elaborates on the division of the lungs into segments based on the tertiary or segmental bronchi. In order to discuss further on this topic, we will first talk about the trachea. The trachea is a fibrocartilaginous conduit that allows the flow of air from the outside environment into the lungs. It presents itself in the shape of a flattened cylinder in its posterior part. This part is constituted by flat and slightly convex fibrous muscle in human beings. The trachea is a tube that originates from the cricoid cartilage of the larynx to the bronchi, linking these two together. It descends from the sixth cervical vertebrae, passing behind the manubrium located at the superior portion of the sternum, becoming intrathoracic and locating itself at the superior mediastinum. It has a length of approximately 11 centimeters in the adult, of which 6 centimeters correspond to the cervical trachea. The trachea ends up branching 1 centimeter from the midline into a right main bronchus and a left main bronchus. The right main bronchus is larger in diameter, twists on its axis, and it's more vertical, making it in line with the trachea than the left main bronchus. In other words, making the right main bronchus posterior than the left main bronchus. The semi-rigid tracheal skeleton is made up of cartilages in the shape of a C, numbers from 16 to 20. Between the cartilaginous rings are located the annular ligaments. On the posterior wall of the trachea, you can find the tracheal muscle joining the free ends of the tracheal cartilage. At the lower end of the trachea, a cartilaginous structure is observed in between the division of the two main bronchi, which is the carina of the trachea. The carina occurs at the fourth thoracic vertebrae that is in line with the sternal angle. It can raise or lower up to 2 vertebrae when breathing occurs. The tracheal division is not symmetrical. The right main bronchus is separated 20 degrees from the vertical axis and is wider as stated before. The left main bronchus is more horizontal with an angle greater than 35 degrees. The left main bronchus is longer and narrower. Each of the bronchi expand into their corresponding lung, whether it's right or left, dividing into the following lobar: bronchus, segmental bronchi, subsegmental bronchi, bronchioles, alveolar sacs, and lastly the alveoli. This division allows us to divide the lobes of the lungs into segments and therefore is called the bronchopulmonary segments.
Bronchi are the entrance to the lungs. These are divided into right and left. The left has 2 branches. It differs from the right with its direction, length, and calibre, and its bronchi of left. The left branch is more inclined outward, insinuate, and is concave, fierce, out and offside, and then towards back arc. It has a width of 10 mm. The left main branch, after a 4 to 5 cm journey, is divided into upper lower branchi for the upper lobe of the lingula, and lower bronchium for the lower lobe.
The left lung, unlike the right, has no middle lobe. However, the term lingula is used to denote a projection of the upper lobe of the left lung that serves as a counterpart. This area of the left lobe, the lingula, means small tongue and is often known as tongue in the lung. There are 2 bronchosingular segments, upper and lower. The left lung is thought to be remained of the middle lobe, which has been lost with evolution. The upper branch gives their segmental bronchi, anterior, apical, and posterior. The last 2 are used to having a common trunk. The anterolower or lingular branch, the homologous of the main right lobar bronchium, results in two segmental bronchi, upper and lower, for the corresponding segments.
We continue with our parter bronchial segmentation. The right lung hamstring lungs. This is the right defined section into which the lungs are divided. The right lobe marked which we will divide in the three lobes, upper, middle, and lower, which enter are divided bronchopulmonary segments.
Okay, as mentioned above, the right lung is divided into three lobar bronchi, which are the upper, middle, and lower. The main right bronchus is a short bronchus that measures approximately 2 centimeters, presents an open angle with respect to the trachea, and gives origin in a right angle to the superior lobar. Become called intermediate, which measure approximately 4 centimeters, ranging in the middle and inferior lobar. The upper lobar bronchus is also short, measuring about 1.5 centimeters, and is trifurcated into three segmental bronchi: the apical upward, anterior forward, and posterior backward. The middle lobar bronchus is directed forward and outward, bifurcating horizontally into two segmental bronchi, the lateral and the medial. The lower lobar bronchus gives rise to five segmental bronchi. The apical bronchus that is born backwards practically at its origin, almost at the same height as the middle lobar, and the basal ones that are born in the forms of a spiral. First the medial basal, lower and forward the anterior basal, then backwards and outwards, the lateral basal, and finally the posterior basal. It should be noted that the main, intermediate, lower and posterior basal bronchi of the lower lobe practically form a right axis, with an upper angle in regard to the trachea.